During pregnancy, a growing belly will pull us forward, contributing to compression in our posterior rib cage and spine. To add to that, we can use more paraspinals, posterior diaphragm, and psoas to help provide spinal stability to make up for lack of abdominal control. This can create extra tension in the body and affect our core and pelvic floor function. So come join me as we explore 2 easy get it done anywhere exercises to work on pulling ourselves back by improving back body expansion. All right, so first we're going to use a step here to put her foot on. So she's going to place her left foot up there, and then she's going to place her hands down towards the block on the inside of her leg. As best she can, she's going to not let that left knee wing out to the side, so she's going to kind of hug it in towards the midline. This is going to help create more opening in the backside of her hip here. If she feels like she has any pinching in the front of her hip or has a hard time getting her hands to touch the block, we can always put something underneath her hands to bring the ground up to her. Now that she's in this position, we've lengthened her back here. We've opened up the back of her hips, and she's going to now inhale into her back and sides and hips. Good. And then she's going to exhale and try to relax down into it a little bit more as best she can. As she goes to inhale, she's trying to not lift up out of the inhale, so she's trying to maintain the compression on the front as best she can to direct more breath into her back and sides and her hips. And exhaling completely, getting all that air out as it feels comfortable. Good. Nice. Let's do one more breath there. Good. And so we can see as she hangs out there, she's able to get down a little bit lower each time. So it might be that, good, you can come and stand back up. She can't get down there to start, but as she kind of works her way into it, her range of motion should improve. Next, we're going to bring some rotation to the picture. So she's going to, again, elevate that left foot up, and she's going to take her right arm and reach it around to the outside of her left knee here. This is helping to bring her right ribs around to that left hip. We're making sure she's not doing that by extending, but instead by connecting in her abs. And so she's going to think about kind of rounding a little bit here as she goes to do that reach. To help open this left chest wall and open these ribs, she's then going to pull her left shoulder blade back to encourage a little bit more of that rotation. So now she's all connected in the front, and she's going to inhale into her back, sides, and hips, and then exhale and see if she can reach a little bit more with that right arm, pull that left arm back a little bit more. And then she's going to inhale again as best she can, and then exhale. Good, and as best she can on that inhale, try to not lift up out of it, but keep that new position that she got. Good. And then exhale, nice and relax out of it. Good. All right, and we'll come back out of there. So again, we can see that as she does a few breaths into there, she can slowly inch into the range of motion a little bit more. Now, one other quick thing to consider when you're having someone inhale while they're pregnant. As someone gets further along in pregnancy, it can be easy to send too much inhale down into their pelvic floor. This is due to the diaphragm already being in more of an inhalated state because it is pulled down and the rib cage is widened to accommodate the baby. The pelvic floor can also be in more of a slackened state due to the position of the pelvis. Someone might complain of having a sense of urgency as they go to inhale, or feeling like that's just too much pressure down, or a sense of vulnerability in their pelvic floor if they're sending too much inhale down. Now, there are a couple things that you can do to help with this. One, you might focus on a full and complete exhale before the subsequent inhale. We're making sure that exhale is the bottom up, and we're really feeling that kind of lift of that pelvic floor and the rib cage close, all while making sure that it's nice and contained pressure that is also not sending that pressure down into the pelvic floor. We can also consider opening up different parts of the core canister. This might be looking at opening up the chest wall, getting those shoulder blades to open up and pull back a little bit more, getting more expansion between the shoulder blades or into the backside of the rib cage, as well as opening up the backside of the pelvis. Make sure to check out some of our other helpful videos that we have here that go into those concepts and opening up those areas to help get more of a balanced inhale that can also help with a more balanced exhale. If you found that content helpful, make sure to like and leave a comment. You can also subscribe to our channel or hit the bell icon to receive notifications for any time a new video comes out. If you're a fitness or movement professional, make sure to check out our course offerings that we have. Information about those can be found in the description below. I'll see you in the next video.